My name is David Wortley, and it's my great pleasure to be acting as a moderator for this session. I'm going to be talking about the role of artificial intelligence and the metaverse in the ageing society. So, I've just organised my screen so that you see my presentation full screen. This is a list of the topics that I plan to go through during my 15-minute presentation, talking about beginning in the challenges of the ageing society and what the metaverse has got to do with health and well-being in the ageing society, give you some examples and finish up with a summary and conclusion. So the ageing society challenge is that longevity has been steadily increasing over the last century. As you can see from this graph, the global life expectancy in some countries is reaching 80 years, but recently it started to decline. One of the reasons for this is the rise in non-communicable diseases. These are lifestyle-related diseases. And this chart shows how the causes of death in developing regions have changed since 1990. And the other thing that's changed is over the last, a period of my lifetime really, is that there are fewer and fewer working people per retired person. And at the end of the Second World War, there are approximately 42 workers per retired person and a pension beneficiary. Today this has dropped to around about 2.9 or even lower in some countries. And the net result of this is that there is an increasing cost of supporting retirement due to these lifestyle related conditions. And this chart shows you some of the problems of comorbidity with people as they're getting older, suffering from multiple medical conditions. And the net result is that there is an imbalance in the cost of healthcare services. There are fewer and fewer working people able to support a growing number of elderly people who have chronic conditions and make a cost to public health services. And this is a picture that shows my mother in a hospital. She was taken there from the care home where she'd been living. She suffered from serious dehydration and almost lost her life, but they managed to recover her. But she suffered from dementia, and she's a classic example of the problems of the ageing society. We're living longer, we need more medical care as we age, there's fewer working people to cover the costs. The caring for the elderly has shifted away from family responsibility to care homes, and in many countries, certainly in the UK, the care for the elderly is a poor relation of the public health services. There aren't enough resources to support the elderly population. Of course, this has been made worse by coronavirus. So, what do we do about it? Well, Sir Simon Stevens, who was the head of the National Health Service in the UK, he recognised the problem of lifestyle-related conditions, particularly obesity, and how that was leading to conditions like cardiovascular problems, diabetes, etc. And he made the point that if we're to avoid a catastrophe in public health services, we need to change our lifestyle behaviours, and to do this as an early age as possible. But what has the metaverse got to do with health? The metaverse is growing in profile and importance, and so I wanted to ask you to think about the metaverse as being an imaginary place that we've all been to as children. We play with imaginary friends or play doctors and nurses, and as we get older we dream about a special holiday, or as a young boy we might imagine scoring a winning goal in a cup final. So the metaverse is like that. It's a place that we go to with our mind, and so the metaverse actually is on a spectrum that goes from reality, which is a physical world, which is real, tangible, we're conscious of it, it's measurable, but we have limited capabilities in this physical world. We cannot immediately transport ourselves to another place. And so it's very physical, it's related to our body rather than our mind. And at the other end of the spectrum, there is a virtual reality, which is an entirely imaginary world, which is intangible, it's in our subconscious, it's difficult to measure, and it's unconstrained, and it's related to our mind. So, as the Chinese say, with yin and yang, physical and mental health are very intertwined. So the metaverse and this idea of imaginary spaces is very important as a component in our overall holistic health. So what the metaverse does, it creates a space that's free from the worries of the world, and it creates an environment that we can explore without many of the constraints of the physical world. And it also gives us a sense of control and freedom, which we probably don't have in our physical lives. It can help with stress management and mental health issues. It can provide a space and facilities for us to exercise, even though we might be living in a city with poor conditions. And it can provide us with an immersive space to socialise and make friends and communicate with other people. And it's capable of diagnosing both physical and mental health problems. And I just want to show you some examples, and this is probably one of my favourite examples, and it shows you the metaverse is not new. This is going back to over 15 years ago to a young man called Simon Stevens who suffered from cerebral palsy, an extraordinary young man, very technologically literate, but with a serious speech problem. And he was able to create his own virtual nightclub called Wheelies in a metaverse called Second Life. And he also took part in a project when I was the founding director of the Serious Games Institute. And the metaverse was very empowering to him. And it was quite a revelation during a project meeting when we made the policy decision, because Simon was one of our project members and had a speech defect, so he's difficult to understand. So I decided that we would all communicate via text chat. And it was one of the most productive meetings we ever had at the Serious Games Institute. And Simon was on a level playing field because he was far more capable with his keyboard than certainly I was, and most of our project board members. So the picture on the left shows the project board meeting in the metaverse. So Wheelies and Second Life delivered both physical and mental empowerment in different ways to a young man who was otherwise what we would describe as being severely disabled. And there are other examples of the use of the metaverse in health and well-being. A project called Snow World, which was researched, explored the potential of virtual reality as a therapy for pain management. So patients who were having their dressings changed, painful experience, had a virtual reality headset, and they played a game designed to knock snowball penguins over with snowballs whilst they're listening to Simon and Garfunkel. And it proved that this escapism, if you want to describe it that way, had a significant effect on pain. That's not the only example. So Snow World was an example, and today we have many different forms of the metaverse, and one of them is a virtual environment called Alco VR, where you can create your own customized apartment. I've made a little video that shows you what Alco VR looks like, but in the interest of time, I'll just summarize the different aspects to this virtual metaverse environment. It provides a social meeting space. It provides us with health-specific videos so we can learn about our own health, personalised content like our own pictures on the wall, and a relaxing environment, the ability to personalise the outside of our apartment with specific health applications, including meditation, access to health information if we want to, meditation as I mentioned. We can also explore the world and go to different places around the world and enjoy therapeutic experiences like swimming with dolphins. So there's a whole range of things, and the amazing thing about this Alco VR is that it's totally free. But there are other projects, and one example of this is a European project called VR to Care, and it explores the potential of the metaverse and 3D environments for smart living and for physical activity and rehabilitation. It has a number of objectives which involve really bringing the physical and virtual worlds together to help us understand the potential of the metaverse, virtual environments and artificial intelligence to explore how this can help, particularly with elderly people in care settings. It also is a tool which increasingly is being used for dementia, because it provides a space where people suffering from dementia can have a very relaxing experience, or maybe revisit places that they've known in their youth and their childhood. And these immersive memory experiences can have a positive impact on dementia patients, but also provide us with tools to enable us to detect conditions like dementia very early. Now, I use the metaverse also for physical exercise, and these gamified metaverse exercises where you can literally cycle around the world or take part in gamified physical exercises that actually help you to enjoy physical exercise and improve your fitness. And this is a little video trailer that shows some examples of the kinds of activities that you can do within this VZ Fit environment with a virtual reality headset. Of course, with the latest generation of virtual reality headsets, Oculus Quest 3, this is going to become more and more accessible and easy for people to enjoy. The metaverse is also used to help with mental health and stress management in particular, and the picture that I showed there shows an example of a 360-degree projector which creates these immersive totally immersive environments that doesn't require a virtual reality headset, so that you can be in a relaxing environment and manage your stress without a virtual reality headset. So in summary, the metaverse creates a space free from the worries of the world. It helps us to provide an environment which we can explore without many of the constraints of the physical world. It gives us a sense of control and freedom, can help us with stress management and mental health issues, provide a space and facilities to exercise, and immersive space to socialise, and it can also help with diagnosing physical and mental health problems. So